Laws are not always black and white. There's an increasing amount of gray, especially in laws related to our health and medicine.
My name is Carolyn Denoya, and I live in Connecticut, and I was hospitalized in 2008 and diagnosed with Crohn's disease.
Clinical trials and research on new medicine are needed to help change laws and create new ones. However, research on medicine produced from marijuana are limited due to the legal nature of the cannabis plant. This documentary will focus on the need for further clinical research of the health benefits from medicine derived from the cannabis plant. There is evidence that shows marijuana use can help treat these symptoms, only it is illegal in many U.S. states and under federal law. These patients are among many that may or may not be able to consider marijuana as a medicine for their illness-related symptoms depending on the state in which they reside. The use of marijuana as an option for treatment of their symptoms may be in direct conflict with their state's applicable laws and penalties.
When I went to the hospital, I was severely underweight and malnourished. I started smoking weed to help reduce my intestinal cramping, and because I started smoking weed, I started having more of an appetite and gained a healthy amount of weight back from smoking.
29% of patients undergoing chemotherapy for cancer treatment will experience nausea and vomiting as a side effect of the treatment. Other medications these patients take to help with cancer and chemotherapy treatment may also cause severe side effects. Smoking marijuana alone can rapidly decrease many of these symptoms while increasing appetite and weight gain.
I was lucky not to get too much nausea, but of course then if I took my pain medication, I was nauseous, like OxyContin and Vicodin and any kind of medicine that they give you for pain, which I went through like 6 or 7 different ones trying to find one that didn't make me feel really sick. There's always so many side effects for the medication that I was trying to take to make me feel better. The medical marijuana was great because I didn't have any of those side effects.
There are 85 active compounds found in marijuana. These chemicals are classified as cannabinoids. The primary method of delivery for the THC compound is smoking and inhalation. This creates adverse health effects of marijuana use due to the inhalation of various toxic compounds and increased respiratory complications. However, THC can be vaporized in order to remove the harsh combustibles produced while smoking the plant. This allows a patient in need of rapid relief to inhale THC as a vapor without any harmful chemicals. The compound can also be ingested, producing a slower onset of the desired effects and still aid in the symptom reduction of nausea, vomiting, and appetite loss. THC can also be cooked into an oil. Once in its oil form, THC can be used to produce liquid drops in order to ingest the compound for its health benefits. Current research shows CBD to be an effective treatment for chronic symptoms without the adverse health effects of smoking or the mind-altering effects of THC. Further research may even provide us with more effective compounds found in marijuana and new medicines that can be made from these compounds.
It has benefited a whole range of medical conditions that have been truly amazing. The endocannabinoid system, that is our own system of receptors and neurotransmitters related to marijuana, is the largest neurotransmitter system in the brain. And yet it was only characterized in 1992, and we really don't know that much about how it operates.
Most of these alternative methods for delivery have not experienced continuous clinical research because of the legal nature of the cannabis plant. With new legislation, we are just barely beginning to see the new yet very recent research. The marijuana plant contains a variety of cannabinoids, many of which have not yet been tested for any medical benefit. With the 23 and growing number of U.S. states passing new legislation helping to legalize marijuana, there are more documented cases and case studies. There are now a growing number of research facilities and grants allotted for the legal study of the plant and its chemicals. This will allow for further scientific research of a substance that may contain more health benefits than we were originally aware of. It may still be a matter of time for the first case studies and clinical trials to produce long-term data. We are currently in the beginning stages of this research and need to continue moving forward in order to provide further data. This will help to better understand the degree to which different compounds found in marijuana can be used for treating different health conditions.
on the left.